Okay, let's start the test. This is a recording for the occupational English test held in AJINORAH institutions, Kochi. The candidate is Rani Alex and the candidate number is 200024654. The interviewer is Anandu Ramesh AK. Interlocutor number is 641384. The role play number is 1 and the profession is nursing. Good afternoon. My name is Anandu. Can you say your name for the record, please?
Good afternoon, sir. My name is Rani Alex.
And what is your candidate number?
My candidate number is 200024654.
Thank you. And you are taking this test as a nurse, is that correct?
Yes.
Thank you. Can I see your ID?
Yes, here it is.
Okay, so please confirm your details on the test paper, then read and sign the candidate declaration. Here is the booklet. Thank you. So I'm going to be working with you for this test. There will be warm-up questions followed by a role play. Remember, this is a test of English, not of your professional knowledge. And please speak naturally. Do you have any questions about this?
No.
The warm-up questions are not assessed, but it is a chance for us to get used to each other's voice. We will just talk for 2 to 3 minutes. Tell me about your routine as a nurse.
As a nurse, my routine day starts with a small prayer. Then I'll receive handover from the previous duty staff. After that, I will check inventory and crash cart. Then I'll go to my assigned patient's room and start patient care. In between, I'll assist doctors in rounds and carry out all the orders. After that, I'll document all the procedures I have done. At the end of the shift, I will give handover to the next duty staff.
Okay. What all are the qualities required for a good nurse?
I personally believe the most important quality required for a nurse is excellent communication skill. It is necessary to maintain an effective relationship with the colleagues and patients and to collect accurate clinical data. The other qualities required for nurses are honesty, veracity, sympathy, empathy, critical thinking skill and problem solving skill.
Great. Thank you very much for sharing that. So let's move on the role play. I will take the part of the patient or perhaps a relative and you will take your professional role. Role play will last 5 minutes. The purpose of the role play is to get evidence of your ability to communicate effectively with the patient. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I will let you know when the 3 minutes are up. You can ask me if there is anything you are not sure about and you can make note on the role play card if you want to. Here is a pen and the role play card.
Okay.
Your 3-minute time starts now. Okay, your preparation time is over. You can look at the card during the test, but you must return it to me at the end of the test. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Yes. Hi, my name is Rani Alex. I'm a registered nurse working in this hospital ward. And for a better conversation, can you tell me your name?
My name is Anandu.
Mr. Anandu, can you please tell me why did you request to see me?
I saw that you just checked on my mother and I want to know how she is doing.
Yes, Anandu, I have just completed my clinical observations on your mom and I'm really happy to share my inferences with you. Your mom is at first stage of recovery and her vital signs were satisfactory. However, she had any memory or speech improvement and she has made slight improvement in her mobility. So, can you tell me what do you think about your mother's condition?
She seemed okay when I last saw her. I'm glad to hear she is a little bit better. I am intending to visit my mother every day, but I want to make sure I don't tire her out.
Okay, I appreciate your willingness to be with your mom, and there are a lot of benefits of regular contact with family. If you visit her regularly, it will help to lift her mood and energize her, and also she will be able to pass time and establish routine. And since you intend to visit her regularly, I would like to explain the visiting regulations. May I proceed?
Sure.
Okay, the most important thing you have to remember in mind is that only maximum of 2 visitors are allowed at the time, and the visit is prohibited at mealtime and treatment time. Are you on the same page?
Yes.
Okay, and there are a few more things you have to remind. Firstly, please limit the visiting time for a short duration, and also during the visit kindly watch for any signs of tiredness, and please remember that there is no need to maintain a continuous conversation during the visit. Okay, do you need any clarification regarding the same?
No, nurse, I will try to be aware when my mother seems tired. When I saw her yesterday, I felt helpless, as I was not sure what I could do for her.
Okay, I can understand that must be a difficult situation for you, and I can enlist you some ways to help her. So firstly, I recommend you to perform mobility exercises together, and it would be beneficial if you could bring personal items of her to prompt her memories. And also I suggest you to give encouragement for her. Can you do that?
Yes, nurse, can I take my mother outside when I visit so she can get some fresh air?
Mr. Anadu, that's a reasonable concern from your side, but I'm sorry to say that at the moment I don't prefer to let your mom leave the ward, as she requires regular monitoring by nursing staff, and also she needs some more improvement in her strength, orientation and mobility. So please wait till then.
If you say so, I will follow your advice about the visit. I hope my mother will be soon well enough to leave the ward.
Okay, I'm so glad to hear that you will follow all the suggestions I have shared, and also I assure you your mom will achieve tremendous progress very soon. And so do you have any other questions before we wrap up?
No, nurse.
Okay, in that case I will leave now, and in case if your mother need anything, please press the buzzer and I will be happy to assist you. So thank you for listening me, Mr. Anadu.
Thank you, nurse.